Kwame is a diabetic whose condition is under control. He's been struggling with a foot ulcer for the past 12 months, with recurring infection and wound breakdown. Antibiotics and antimicrobial dressings have had minimal effect. If not treated effectively, he faces the risk of losing his limb. What might be the real problem he's facing? Biofilm. A biofilm is a thick, slimy layer secreted by a community of bacteria that surrounds, protects, and attaches to living and non-living surfaces. Why are biofilms such a problem? More than 90% of chronic wounds have a biofilm. It's invisible to the naked eye. It induces a chronic inflammatory response that prolongs wound healing. It's impenetrable to antibiotics, antibodies, and antimicrobials. Exchanging information between different species, bacteria teach each other to become resistant to antibiotics. That's frightening. Planktonic bacteria attach themselves to the surface of the wound bed, forming irreversible attachments in 2 to 4 hours. It secretes a slimy layer and becomes increasingly resistant to antibiotics and antiseptics within 6 to 12 hours. It grows into a mature biofilm in 2 to 3 days. Then it releases bacteria into the environment to settle down somewhere else. If destroyed mechanically or by using products that cannot penetrate and remove the biofilm, a mature biofilm can simply reform. Within 24 hours, it will be back in full strength before the next wound dressing change. This is one of the reasons that biofilms cause a delay in wound healing. So what's the solution? Pathelen. It contains a unique patented formula, a combination of 2 highly dispersed silica and a surfactant that enables Pathelen to clean and prevent infections within the wound bed. How does Pathelen work? Pathelen's effect is purely physical, by disrupting and removing the biofilm by extracting its liquid, absorbing any amount of wound exudate, enabling granulation tissue to form without any disruptive cytotoxic side effect. For best results, cleanse wound with a saline solution. If necessary, conduct thorough debridement. Shake a 60 ml bottle of Pathelen vigorously for 20 seconds before application. Immediately and carefully apply Pathelen in an even layer. After application, dress the wound with sterile wound dressing. Depending on the severity of the wound, further treatment should be continued after 24 to 72 hours. Applying Pathelen wound powder extends the cleansing action and infection prevention until the next wound dressing change. Repeat the application until the formation of granulation tissue. Pathelen will show a significantly faster reduction in wound size in a short period of time. Within weeks, Kwame's foot ulcer healed using Pathelen. Pathelen is a cost-effective wound treatment to remove and prevent biofilm formation, prevent complications, and improve the patient's quality of life. Remember, only a clean wound can heal. Think wound care. Think Pathelen.
Learn more by visiting www.pathelenhybrid.com.